Doctor number 700.
Don't really improve. Each symptom may improve, but then it's the whack-a-mole game. One problem gets better, another problem gets worse.
Think of the symptoms as like smoke, and then the fire is this miscommunication.
It's sort of a software problem in the brain as being opposed to structural issues.
Doctor number 700. That is a joke I make with families who come to see me after months, if not years, of searching for answers. And today I am talking with a doctor who has spent over 20 years helping people finally understand what is happening in their brain and body. My guest today is Dr. Dario Zagar, a neurologist at Yale University and a founding member of the Functional Neurological Disorder Society. But before he became an expert in this field, just like other people, he lived it. You'll hear from him directly, but in his early 20s, he struggled with back pain that doctors could not explain, much like my own personal experience. And there was a book about mind and body medicine that changed how he saw his own health, and it changed the path of his entire career. For those who are new to my channel, welcome. I am Dr. Lee, a licensed clinical psychologist who works with teens and families facing FND or functional neurological disorder. I created my coaching program called Teen FND Academy to help these families get their lives back. And today's conversation is not just about FND, because Dr. Zagar treats chronic pain, including migraine, and a wide range of conditions that all trace back to the same root cause, which is the brain and body are not communicating with each other smoothly. We talk about the pathophysiology behind these conditions, why the brain and body can get stuck in these old patterns, and how neuroplasticity gives people a real path to retrain the brain and reset the nervous system, much like what I talk about all the time on this channel. So if you or your family have ever felt unheard or misunderstood, stay with us. This conversation may change how you see your path forward. So let's dive in. Welcome to my channel, Dr.
Thank you for having me.
Yes, it's so delight to have you on my channel, and I have so many questions, and parents in my community have been eager to ask a lot of questions. So I am going to do my best to represent what they want to know. But for those of people who don't know you, could you tell me a little bit about who you are, your background, kind of how you get to what you're doing right now?
Sure. So I'm Dario Zagar. I'm a general neurologist. I'm with Yale University, and I'm in mainly outpatient practice. I've been in practice for over 20 years, and I see the wide range of neurological conditions. But FND has definitely become one of my focuses of treatment for a few reasons. So how I got interested in it, really became interested in sort of mind-body medicine in general while I was a medical student. Like a lot of people from personal experience, actually. I started having issues with back pain after college and didn't really get good answers as to why this was happening. But it was really having a significant effect on my life. And then I encountered, a book called Healing Back Pain by John Sarno, who was sort of a pioneer in mind-body medicine. And it was one of these like mind-blown situations where I was like reading the first couple of pages and I'm like, this is me. This is what I have. And it was really the start of understanding how the brain and the nervous system are affected by not only structural issues, but by other factors like emotions and other life experiences in ways that really I knew nothing about, and honestly learned very little about in medical school and residency, because these approaches, unfortunately, particularly then, were not part of standard practice. They're still not really part of typical practice of neurology or otherwise, but fortunately are becoming more common. People are incorporating aspects of mind-body approaches in various fields. And so it's something that's growing, even though it's not yet part of the kind of mainstream, if you will. It's really getting there. And I don't have to tell you, because at the conferences we've been to together, like the recent FND conference and Neuroplastic Symptoms conference. I mean, I went to a conference. I went to what became the Neuroplastic Symptoms Society, the first meeting about 17 years ago. And there were, I think, maybe 30 of us there. And then, what's at the last couple of meetings? Hundreds of people. So this is really, fortunately, a growing area of interest. And it's really exciting, having people like you doing this work, and us really learning from each other. And there's just so much new information over the years. We understand much more, even though there's a lot we still are learning. The knowledge we've gained, particularly in terms of neuroscience and what causes problems like FND, which are exceedingly common, and people don't even know about them. Many physicians are just very not well versed in it, and average people definitely don't really know about it. So, there's a lot that we can do. But I think, a lot of people in the mind body field came through it from similar experiences.
For sure. Yes. Oh my gosh. We can go into so many different directions with this.
Yeah.
And one thing that comes to my mind is that I didn't know that you were actually, I guess, introduced this mind body approach when you were in medical school. And so you had this like firsthand experience of
Mhm.
what was not there when you were learning, right?
Yeah.
You know what I mean? Outside
Hmm.
of that
Yes.
medical school. So did you feel like there is a disconnect in what you were learning and inside versus outside of the medical school? And
Definitely.
how, I don't know, you were able to talk to your colleagues and there's a lot of stigma with the mind body and
Hmm.
all this anything except dichotomous thing, right? It's either
Hmm.
physical or mental,
Correct.
and if
Hmm.
it's right, so there's that very black and white culture, because I grew up in that culture too, and then I felt like I was an outcast when my reality was somewhere else.
Yeah,
So,
you're
yeah, I'm
correct.
super curious about your experience.
So what I would say is, as a trainee in medical school and in residency, I kind of had to keep my mouth shut, and just observe and learn and really kind of go by the usual standard approaches, because it's you really it was not something I could really talk much about. And then but I knew the more patients I saw, the more I realized that this approach and these concepts are important to people, because the standard approach doesn't really serve many people. And anyone who pays attention has to see these kind of things that go together. Certain people are more prone to getting certain problems, but unfortunately, oftentimes each condition is treated separately. And people just make the merry-go-round from doctor to doctor and don't really improve. Each symptom may improve, but then it's the whack-a-mole game. One problem gets better, another problem gets worse, and it's incredibly frustrating, because you have people often who are young and healthy who have a constellation of symptoms that really affect their life in a significant way and don't really get answers that explain what they're going through. They may get names, FND, for example, a name, but for a lot of people, they don't really understand it, and other common conditions. And so as I started in practice, I started little by little trying to work these concepts in gingerly, but it's definitely gotten better, because we understand, we can explain things, we can use these techniques in ways that I think are more understandable, explain people's experiences better, in ways that can really open their minds and really help them to understand what they're going through, and find and learn new ways to improve.
Absolutely. Yes. And one of many, many reasons why I wanted to bring you onto my YouTube channel podcast was because I hear this every single day, that these either adults with, who are struggling with FND and or other things, or the parents and the kids who have been given this diagnosis, number one thing that I hear all the time is how their experience in the medical system has been very negative and dismissive, right? And then, well, there's nothing wrong with you, so you don't need to come see us, right? Or what you have is all psychological, right? It's all in your head. Go see a therapist, and just that kind of not enough explanation or compassion. And so I really wanted to show to and tell basically everybody there's someone like you who exists on this planet. And from my perspective, I know these providers are doing their best, in what they have, right? And then a lot of times what they have is very limited. resource, time, right? What they can do and cannot do. And so I have a compassion for those providers too, because I have been, part of the team for a long
Hmm.
time. And
Yes.
so, by all means, I cannot speak for every single provider, but I can only imagine, how that gap, is creating that unwanted consequence and negative experience on the
Yes.
patient's side of it.
Yeah.
So,
I can't think of a condition that is more stigmatized than FND, really. I mean, you look, it is for many people, it's an invisible syndrome, people, because some of the manifestations may not be visible, or the ones that are can be easily misunderstood. And so you're right. I think a lot of it comes from a lack of knowledge. It's not from a lack of caring, although unfortunately it often looks that way. But people don't understand it. They don't know what to do with it. They don't really know how to diagnose it. And so I think that automatically gives this feeling of dismissiveness. And, unfortunately, I would say, if not most, then many people, by the time they see someone like me, have had almost like medical trauma, to be honest, because most people have had so many negative experiences. And that certainly can be a hindrance to recovery. It certainly can add to psychological stress and can make people not want to really engage with physicians, with other treaters, because they've had such negative experiences. Like, why is the next one going to be better?
yeah, yeah, absolutely. And I usually joke to the patients and the families that I meet, like by the time they come see me, I'm like the doctor number 700, right? And then like they come
Often.
in with like the
Hmm.
pretzels, like arms crossed and legs crossed, and then they're like
Totally.
this,
Totally.
this trusting, right, mistrusting
Hmm.
attitude, rightfully
Hmm.
so. And they're like, "What are you gonna
Yes.
do?" That.
Hmm.
So I have huge compassion for these people, and they're there
Hmm.
as a response to what had happened,
But you're right. I
how long.
think just I think people can sense when you come to things with a openness, with a compassion, with an understanding, and showing that what, you know, you don't know what they're going through, but you can sympathize with what they're going through, and you can hopefully give them some answers and help to explain what they're experiencing and help them to put pieces together. I think people really appreciate that.
Absolutely. Yes. Yes. I love it. So moving on to the next question of kind of defining this like mind body, and there are a lot
Hmm.
of terms, right? Software problem, hardware
Hmm.
problem, and neuroplastics, and I mean
Hmm.
there's so many. And so this is not just with FND, it could be also chronic pain,
Hmm.
fatigue, and all of the other quote
Yeah.
unquote medically
Hmm.
unexplainable
Right.
situations. So how do you define mind body neuroplastic phenomenon and symptoms?
Yeah. Good
Let's
question.
say,
So,
yeah.
and I think some people listening to this, from the FND perspective may say, well, okay, this guy started with back pain. What does that have to do with FND, for example? But so I think, and you're right. One of the problems is that there's been so many different terms used. There's not a lot of standardization. I think the kind of a current term I think is very useful is neuroplastic symptoms. And the concept neuroplastic means being related to brain learning, to brain pathways, like you said, sort of a software problem in the brain as being opposed to structural issues. And the way that I explain it in general is that there are a number of different symptoms that people can have, anywhere from pain to migraine to FND to other physical symptoms, and a host of common issues that affect different body systems that are related not to structural damage in the body, but really with issues with the way that the brain is misprocessing information from the body. And the reason why it's useful to look at it in this way is that, as we were kind of hinting at before, if you treat each problem separately, you're not really treating the problem, you're just treating the symptoms. Because whether the problem is back pain or headaches or digestive problems or weakness or dizziness, no matter what symptom it is, the problem is in the brain and how the brain is not communicating with this part of the body correctly. And so again, I look at FND as a neuroplastic symptom. And that can be helpful again, because most people with FND don't just have FND. They have other symptoms too. Almost all of them have some sort of pain or fatigue or other IBS, sleep problems, palpitations, numbness or tingling, mood issues, different problems that are really all interconnected. And that's key to understanding it. So I think it's very important to look at things in this broader perspective rather than putting each thing in a different silo. And this is where the naming can be complicated because each problem has a different name, which makes them sound separate when really it best, looking at them together. And I think in the future, one thing that would be nice, although I don't know if this is ever going to happen, is really kind of naming things in a way that highlights their commonality rather than their differences. And, part of this is just part of the way that the medical system works, that most people work within their subspecialty and don't necessarily kind of connect the dots between these different issues. And again, I don't fault anyone. This is just kind of the way things usually work. And so I think it's helpful when people are willing to take a step back and go maybe outside their comfort zone. Okay, I'm not a neurologist, I'm a gastroenterologist, or vice versa, but looking at how things can go together so that we can work together to help people.
Yes, absolutely. And logistically speaking, the reality is that not all these providers are working in the same hospital system, right? Or let alone on the same floor per se. So then the communication between different providers isn't necessarily robust, in different areas, depending on who where you are. But I love it. And yes, to me, it's the same thing. Everyone I work with there, I've never seen anyone who only had one thing of FND. And even within FND, right, there are so many different symptoms. And the way I explain to these families is that think of the symptoms as like smoke, and then the fire is this miscommunication of the brain and the body. So while we can chase and try to, get rid of this smoke one by one, as long as that there is a fire, it'll continue to have, smoke somewhere else. That's why it feels like
for sure.
a whack-a-mole, right, situation. And then having 20 different doctors for 20 different problems and thinking that the problem is the fire when the problem is the symptom, which is that smoke, of the fire. So I'm glad we're talking about the same thing.
Yes.
And speaking of, and this is what I get a lot too, when families come see me, they are thinking about how could we get rid of FND? And so their definition of recovery is cured. That means there is no more symptom. And from neuroplastic perspective, again, chasing symptom isn't necessarily the only thing that we need to focus on. And so how would you describe or educate the definition of recovery from your perspective?
That's a good question. So the first thing is not expecting perfection, because I think, again, and it's not uncommon for people with neuroplastic symptoms, including FND, to be perfectionists, to put a lot of pressure on themselves. And so sometimes this need for things to be perfect quickly actually adds more stress to the situation and can be a hindrance to recovery. In some cases, once people kind of learn about this, they're like, okay, I get it. I'm doing this and I'm going to be the best person. I'm going to do this better than anyone ever did it. And I'm going to be better tomorrow. And so part of it is helping them to recognize, look, this is a process, and things that may have served you in the past are not necessarily going to serve you well through this. You have to take a step back and really, again, look at this as a process. And it's not only a process just of getting better, it's really a lifelong process of learning and discovery and learning what these symptoms mean, learning what's contributing to them, and helping to learn what this may mean to you. What is this telling you? What significance do these symptoms have? What are the factors that play a role in your symptoms? Because another thing is everyone is different. Everyone with FND is different. And so the approach is going to be different and their pathway is going to be different. But it's really, the goal is improving function, helping people get back to as normal a life as possible. And of course, our goal is for them to be doing everything the way they normally did. Now, that's not the case for everyone, but that's our goal. But that being said, symptom elimination, number one, is not always possible because it's, in a way, these symptoms are part of the human condition. We all can have symptoms at different times in our life for different reasons. And so part of it is being able to really understand yourself, your brain, your body, so that you are able to deal with the ups and downs of life and with symptoms that come up to get not only better now, but just to be able to handle things that are going to come in the future. Because it's also very uncommon for people to have, okay, I had these symptoms once and I never had any symptoms again, right? I mean, like, there are ups and downs, and recovery doesn't go in a straight line. It's right, ups and downs. So it's helping people to understand that setbacks are normal. They don't mean catastrophe. It's not the end of the world. This is normal. This is what happens, and that's okay. We'll deal with that. It's bad days are going to happen. And so that's another part, is helping people just to recognize that this is normal, so that they don't stress out so much when symptoms are up and down. Another thing is that sometimes, if you've seen this, that people can have improvement of symptoms, but this underlying fear that does not improve. And so I've seen people where they have symptoms, but they function well. They are not focusing on their symptoms. And I have people where their symptoms go away and their life stays very small, and they remain fearful and avoiding things. And so people can have improvement of symptoms, but not actually recover in the way that someone is still having symptoms can recover, if that makes sense.
100%. Yes. So in my program, I teach families to the skills and strategies to get their lives back, right, with or without symptoms.
Totally.
And so that the goal is really become how to get their life back, and what that sort of quote unquote normal life would look like, because it's different for everybody. And the how to get there, in the big picture, there are two ingredients. One is a sense of empowerment. So they feel like they're in control of themselves, and also having the self-awareness. And then we talk about like interception, seption a lot at the conference. But it's really that. So because a lot of these people are hyper focused on symptoms or what's wrong, with me, that fear driven, and the solution is either avoid or escape. And then that is the whole fear, cycle, right? It is also called the pain as well. And so just because their world is shrinking doesn't necessarily mean that they're getting better, to your point. And so those are the two ingredients I say to them. This is a must ingredient, for you to get out of this club they didn't sign up for.
Exactly.
Yeah, I always joke like, yeah, welcome to the club you didn't sign up for, but there's an exit.
Yeah. And so this is where, to your point, the empowerment comes first and foremost from education and knowledge, people to understand what they're dealing with and reframing what they're experiencing, So that's part one, is really just understanding, knowing. And so for many people, just that initial diagnosis is really the first, and for some people, the most important part of their recovery. This is what you have. This is what you're dealing with. This is what it means. And people can sort of go on from there, because people cannot improve without a diagnosis. Now, having it doesn't mean someone will improve, but they almost certainly will not unless they get a correct diagnosis. And sometimes that's the hardest part. People go through this long process before they get to that, which is very frustrating.
Gosh. Yes, yes. And it's really sad, because sometimes it takes them years, to get to that diagnosis. And it's not their fault, right? But it's just that it just happened to be, taking the winding, path in so many different reasons. This is really helpful. And then kind of piggyback on what you mentioned, that, we talk about this. There's never one thing that is causing the FND or chronic pain, for that matter. And it's like the physical, biological, emotional, psychological, and the social part, the biopsychosocial model. And then there's also what I would call the triple P, what was kind of cooking in the oven, like predisposing factors, right? And then what kind of triggered or started the precipitating factors, and what is keeping the fire of FND alive, the perpetuating factors. So the fear, hyper monitoring, and hyper vigilance may not have been the reason why they started, but there definitely is the perpetuating, factor.
Yeah, that's
right?
a big one.
Yeah, how they keep them stuck, of that club they didn't sign up for. So that's why it's just never this one thing. It's not just, oh, it's just one trauma, right? Oh, it's just one medication. It's just the one vitamin, it's not just one thing, but collection of those things are going
Agree.
to really move them, forward towards
Yes.
recovery.
And I
Yeah.
think that's one of the things that's been most helpful and interesting about what we've learned over the last 10, 20 years about FND, getting away from the idea of what was this one thing? What did it? And
Hmm.
people can spend all this time looking for what this one thing was. And I think, sometimes it is just one thing, but not usually, I mean, again, it's a situation where anyone can have you know, an event that can be a trigger. But more often than not, there, like you said, this combination of factors and looking for this one thing is just putting your focus in the wrong place instead of looking the bigger picture. And I think it's also something that old model is still, I think, entrenched in the medical community, that people still look at it in the old term of conversion disorder. And so what is it that's there? What is it that's being converted? What is it that is the trauma? And again, it's not, you're going to miss a lot of things if that's all you're looking for, and you have an incomplete understanding of what's going on if that's what you're the lens that you're looking at it through.
For sure. Yeah. And I'm super curious about like how you have experienced this evolution of diagnosis, stigma, from conversion disorder. I mean,
Mm-hmm.
like 100 years ago or maybe thousands of years ago, it's a hysteria, and then
Mm-hmm.
now onto FND and yeah, this like misconception, right, of
Mm-hmm.
what it is. And to me, FND is very interesting in a way that has evolved. But to me, also like on from a different angle, chronic pain is also similar in a sense that chronic pain still lives in heavily standard medical, conventional medical
Yeah.
model, right? It's got to
Even
be
more so
that.
than FND. Like they're almost like
Exactly.
the opposite poles, in terms of
Exactly.
how most people still look at it. One is emotional,
Yes.
one is structural. When really
Completely.
there's
Yeah. In a different way, but like far,
Mhm.
far from the truth, so to speak. Yeah. So I don't know if you have experience of when you're diagnosis your patients with FND and then anyone knew what it was, because with my experience of working with tons and tons of families, nobody knew what it was until they got the diagnosis. And so is it similar?
I can think of like a couple of people where I tell them and they're like, so and so told me that's what it was. That's so uncommon though. And I had,
Okay.
I had another woman who didn't believe it until ChatGPT told her that's what it was. She came in with her printed conversation, and it
Oh,
came up with, this is what you have, functional dizziness, 3PD. She's like, see, this is what ChatGPT told me I have. And then she believed it.
wow.
But
Interesting.
that's rare. But the interesting thing is that I'm impressed that ChatGPT and other GPTs will come up with neuroplastic diagnoses when you put in certain things, which is reassuring. I don't think sometimes it's because of what you've searched for before, but I think when I use some neutral ones.
Yeah.
So I think that's a good thing because it means it's becoming more of a standard part of diagnosis. And I don't have to tell you that people more and more frequently are going to GPT for their diagnoses when they feel like they're not getting the answers that what they feel is the right answer for them. And
Oh,
so I
yeah.
think, we can't ignore that, and we have to really, try to take that into account, and hopefully it will help people to steer people more in the right direction. And maybe it'll even make people come in more often. And with that, this is what I heard I could have. Um,
Right,
you
right.
know,
Yeah.
I looked
Have there
up,
more buy-in from.
yeah, well, it certainly helps. It helps.
Yeah, for sure. Yes. Speaking of, I get, some of the families are asking this question about, once again, what is this one thing in that same way? These families have gone through so many different doctors, right? So many different tests. And then along the way, at some point, they're going to find something, whether it's a benign cyst, right? Or some
Mm-hmm.
flare ups in the brain MRI and things like
Yep.
that. And so, is there any that we know of those biological links that are connected to these conditions?
When it comes to imaging findings, the answer is almost always no, that it's typically unrelated. I mean, one of the challenges that is that finding abnormalities on an MRI, let's say of the brain, is exceedingly common. Normal abnormalities, in 5% or more of people, it depends on the age group, you're going to find something. You're going to find a pineal cyst. You're going to find a Chiari malformation. You're going to find some white matter hyperintensities. These are some of the common things. Or in an MRI of the spine, even more. I mean, when you go into adulthood, 50%, 60%, certain ages, 100%. And so part of it is not getting hung up on these structural findings that are really normal abnormalities. And so again, this is where it's important to have someone who can put that into the context and not just point to that and say, oh, see, here's the problem. When in fact, it's really just an incidental finding. So again, that's something that's usually a red herring and a reason why, workup is needed to exclude certain causes, but it's a reason why we don't want to do just an indiscriminate workup, because you're just more likely to find these normal abnormalities that are going to be more confusing than helpful. And then when it comes to other conditions, this is something we're learning more about. So just to wade into a little bit of controversy, what I'm sure you're seeing a lot recently is diagnosis of Ehlers-Danlos syndrome or other joint hypermobility. And so, oh brother, right. And so oftentimes all of someone's symptoms are being attributed to this joint hypermobility, sometimes probably fitting just with a normal variant. Other times with something that's more than normal and maybe a clinical syndrome like Ehlers-Danlos with dislocations or other issues. But we're seeing quite frequently, as I'm sure you are, that there's this crossover between FND, even in these patients, and a higher incidence of functional disorders. And so sometimes the challenge is trying to piece apart the different components. But I think, again, this is something we're going to learn more about over time. Why is that the case? Because I don't think it's just a coincidence. But it's also important, to give people this other knowledge to say, look, this is coming from this, but I think there are probably some other things going on over here in this neuroplastic realm that we can use some other strategies to help you to feel better and to work on that. And all of this is kind of a work in progress.
Absolutely. And I don't know how, but like suddenly EDS is like on a spotlight, right? It wasn't like it wasn't there, but it just, they go through phases, right? Like a musical chair.
Totally. Yeah. Yeah. So that's because it's on everyone's radar now. And so people are just picking up. And, I can't remember the exact number of people who have some benign joint hypermobility, but it's over 10%. And in younger age groups, even higher. So I think you're just going to pick it up pretty frequently. And again, in many cases, it may be a normal abnormality for some people. Though again, not for everyone.
Right. Yeah. And this is also the stuff that I see with teens. It's the combination of, between POTS, EDS, FND, and chronic pain, right? These like four things, they kind of tend to go together. And once again, depending on the providers they have seen, they were told, this is permanent. This is why you have constant dizziness, for example, with POTS, right? And then this is why you have a constant pain because of EDS. And then these feelings of almost like helplessness, and I wouldn't necessarily say a victim mindset, but like helplessness. Well, there's nothing I can do, it's that mindset. And I really think that there's a lot of neuroplastic, commonalities amongst these and then some. And
I would agree.
right. And then this is also a good example of you can have these symptoms, in the absence of something structural. And you can also have these structural things and no symptoms, right? Right. So.
Yes. Yeah, it's very confusing. And one of the things that's most challenging about neuroplastic symptoms like FND is that I cannot put up a test that's going to show you on a screen that that's the problem that you have, And I think that's difficult. People want some sort of evidence, visible evidence on a test of some sort. And people will often say, you hear this all the time, I wish that something was abnormal on my testing so people would believe me.
Yeah.
Or that, and so, it's difficult. And I think that's another reason why some medical professionals are loath to make the diagnosis or skeptical of the diagnosis, because again, unlike many things, most things that we see, you get a blood test, you get an imaging study, there's some sort of corroboration. There's not for FND. There are positive signs on examination, physical examination, but again, that takes being becoming well versed with them and getting experienced and knowing what these look like and how to differentiate them from other things. But, and we use that to teach our patients too. They used to the old way of doing it is don't show the patients those things on examination, as if somehow either you're going to offend them or maybe you're going to, you're not exactly sure why, but it's actually incredibly helpful because that's the evidence we can give. We can say, look, see this tremor that you have, and then this is what we're going to do. And we can make that go away temporarily. And people go, wow, how did you do that? My tremor hasn't gone away for months. And we did it right there in the office. So that can actually be very powerful, that sort of evidence. But we don't have a scan. We don't have a blood test. We don't have anything there. And so I think that's a big challenge.
Yes. Going back to the conversation earlier a little bit, I do hear from a lot of families that they wish they had like tumor or multiple sclerosis, right? It makes sense, for them to actually be able to see it. And then very much in that, sort of like camp. And also it used to be, the FND was used to be considered the diagnosis of exclusion. Like we can't find anything, therefore it must be, and it's not that anymore. It's more leaning towards a diagnosis of inclusion. And I do talk just briefly on how FND is diagnosed in a clinic. So could you run sort of like a short list of 10,000-foot overview of how you would diagnose individuals with FND? Obviously, depending on that.
Like all things, particularly neurology, it starts with the history, So what are the symptoms someone has? How did they start? Did they start all of a sudden? Did they start after an injury of some sort? Sometimes maybe it did start after some sort of emotional stressor, but it could start after an illness, an injury. Sometimes not from anything in particular, but a sudden onset would be common, as opposed to, which depending on the symptom might be a bit unusual. A constellation of symptoms or symptoms that move around. Sometimes that could be a clue. Interestingly, it's not because of psychological factors. We don't make the diagnosis just because someone has a history of depression or because someone has PTSD or something like that. I think that's another misconception. You just made this diagnosis because I have depression. And I think sometimes people want to hide that because they don't want to bias the person seeing them. And I do not blame them, because I think sometimes people do jump to conclusions based on a prior history or a history of mental health issues. But that's not how we make the diagnosis. FND can be diagnosed in someone with zero mental health history, and people who have problems like depression and anxiety certainly can have other conditions. So that's another thing just to mention, that's not, it can be a supporting factor or it can be a clue, but it's not how you make the diagnosis. And then often findings on examination. So this is where skills and practice come into play. And what's one of the things that's interesting about neurology is that we can learn a lot from our examination. Where is the weakness? What does it look like? There are certain patterns of weakness. Where is the numbness? What is the location? Abnormal movements. When do they come? What makes them better or worse? Can we make them go away through a distraction technique? What does the walking look like? There are certain patterns of walking abnormalities that are characteristic with FND. And so this is where experience is really important, because people can get fooled either way. There are certain other neurologic conditions that can be confused with FND and vice versa. And then in some cases, some tests can be helpful. So for example, if someone has functional seizures, which is one of the more common types of FND in the pediatric population, in many cases, it will be, first of all, just watching a video, because again, seeing an event can be really important. Without seeing it, it can be hard. And studies show that neurologists, particularly epilepsy specialists, are pretty good at being able to diagnose a functional seizure versus an epileptic seizure. But in many cases, we may need to have someone on an EEG and try to capture the event. Do they have evidence of epilepsy during, epileptic abnormalities on the EEG during the event or not? So this is where tests can come in, but it's usually negative tests. What are you not seeing on the test? And then in some cases, you may need to do some other tests. You may need to do an MRI of the brain, or you may need to do some blood tests to exclude other conditions. So again, it's not a diagnosis of exclusion, as you said. Some people think, well, first you do every single test possible, and then if that's normal, then it's FND, and that's why you made the diagnosis. So it doesn't satisfy anyone, because you can always do more tests. And the absence of information is never satisfying for a diagnosis, right? And that's where people get this idea that it's a sort of a wastebasket. You don't know what it is, so you're calling it FND. But as you said, we make the diagnosis based on things that are there, not just because of what is not there.
Yeah. In medical term, right, we call it the positive signs. There's nothing really like positive, about it, but like it's something there.
Right. It's not positive, but yes, something that's there, not just something that's not there.
Yeah. And then everything
sometimes
negative,
it's looking at other conditions that people have too. Again, with neuroplastic symptoms, these problems tend to run together. So that can sometimes be helpful. How do things move around? Did it start as this and then go here and then go here? And again, these can be helpful clues in some cases as well.
Absolutely. And for sure, it comes with the experience of, sort of like investigative work, right? Like as a detective,
Totally.
and then going through the list and then pattern recognition and, okay, this doesn't quite fit, this picture. And so then that's sort of like how, we run through, these diagnostics. And yes, and not every provider is good at communicating what's going on in their head, of going through that list. It's not that they're not doing their job, and sometimes it can be about communication.
And so telling people that I try to say this is what I'm seeing and this is why I've come up with this diagnosis, because people deserve to know why, and it's important. It helps them to get buy-in and to understand why we're making the diagnosis.
Yeah. And sometimes, it's not, the families or individuals may not have the luxury of seeing a neurologist who can take the time and explain these things. It could be hospitalists, it could be, like inside the ER and just different situations. And what I see a lot is what can we do to provide more training and education to these healthcare providers, so then it kind of is an upstream thing. And I don't know, you're in that system, and where do you see things are going, and what would be your hope, and what would be like, what did you wish that you would have known?
So these are all really important questions, because you're right, it's through education, through educating providers and physicians and otherwise, that is going to help to improve diagnosis and treatment of FND. And so first is just including it more into standard medical training and curriculums, both in medical school and in subspecialty training, making it, devoting more time to it instead of it being sort of an afterthought, which I think is generally what it's been. We'll work on the real neurology here, and then, maybe we'll get to this other stuff afterwards if we have time, and saying, look, this is so common. 40% of people in a general neurology practice probably have, some sort of neuroplastic symptom, FND, or other unexplained symptoms. So this is really common. So this is something that we should be spending a lot of time on, and it's crazy. So I think the first part is just really improving education. And some of it comes from improving the legitimacy of the condition, the treatment, the diagnosis. And this is where organizations like the Functional Neurological Disorder Society play a big role, because for advocacy, both for patients, but also for medical training. So I think that's really going to be important. And it should come every step, in medical school, but then in residency training, CME courses. I think these are things that people actually want to know. They want to know about it, but I think they feel like they don't really know where to get that information. And so, of course, working with residents, working with medical students, I try to, to include that in whenever I'm working with them, because even one-on-one can be the best way. Seeing a patient with them, seeing how we make the diagnosis, how we present the diagnosis, they always find it interesting and exciting, because it is.
Yeah. And I can only imagine these providers coming to this healthcare world wanting to help, their patients and then make an impact. And so it's just a matter of having the window of opportunities, right, for them to become more equipped to deal with, these incredibly common situations, yet grossly under,
Absolutely.
sort of relationship. And so speaking of, you're writing a book. Tell me more about it, because that is extension of educate.
So I've been working on this for the last almost a couple of years now. So the tentative title is "What's My Brain Got to Do with It?" And so again, it's for the general public and really to help them to understand the concept of neuroplastic symptoms from a neurologist's perspective, just helping people to understand what's going on in the brain, what kind of conditions does this play a role in, how do we make this determination, and what can we do to get better. And so again, fortunately, there are, even in the last couple of years, there are a number of other books that are targeting this, which I think is amazing. The more, the better. And the more people go on podcasts and videos and other things, really it's just about education and getting the word out there. And I think in a way that's hopefully readable and interesting, and with some other kind of interesting neurologic tidbits thrown in. But I think, it's the kind of thing that hopefully people will enjoy. And with these kinds of issues, neuroplastic conditions, I think some of it is also bottom up. The hope is that not only are physicians going to learn about it in their way, but they're going to hear about it from their own patients, because that does happen. People go to their primary doctor. I read this book and, this really helped me. And maybe they'll go, oh, that's pretty cool. They were dealing with these problems for a long time and now they're doing better. This is the kind of thing that stimulates interest all around. So we'll see. Hopefully this will come to fruition.
Yes, sooner than later. And I can only imagine that there's so many people who would benefit, from that knowledge, and then hearing from people like you who not only had a personal, experience, and also professionally, this is what you do. So it's going to be a lot more impactful and to me convincing, like, okay, this is a legitimate thing.
Yeah. And I realize sort of when I tell patients about these concepts, which is quite frequently, almost all the time they're hearing these concepts for the first time. This is new to them. And so, I thought, I love working with patients and, helping people to understand things one-on-one, but how can we help more people, to learn about this? Because there are so many people who are suffering from different health conditions, chronic pain, FND, et cetera, that, hopefully can benefit from wider knowledge.
Yes, we have a hypothesis that chronic pain is, part of this, functional, neuroplastic, and all of that. And then so are POTS, EDS, and then so many other things associated with it. So we've got more to work on, but
Yeah, totally.
I'm super excited, about this. So if you were to say any final words or anything, some wisdom that you would like to share with the audience who are going through this firsthand, whether it's an adult with FND or parents of kids with
Yeah.
FND, what would you say to them?
Yeah. So the first thing I would say is I sympathize with what you're going through. It is a challenging journey. It's a difficult problem to deal with. They really are impactful in ways that I think most people don't appreciate. So the first thing is just saying, I feel for what you're going through. The second is that these are things that people can improve from. We tell someone that, because this is not because of structural damage in the nervous system, because it's from these neuroplastic software problems, that people have a great capacity to improve. That's the hopeful part of it. It's not a simple improvement. There's not a pill that fixes the problem. There's not a single treatment there's not a surgery that fixes it. So that can be frustrating for people because it's a complicated problem and it has a complicated solution. But at the same time, with knowledge, persistence, with hopefully working with compassionate and knowledgeable team of providers, people have a great capacity for recovery. And so that's my word to them.
Yes. And then you do work with adults, and so you have more exposure to that population.
Correct.
I work with kids. And so, like the neuroplasticity is greater when an individual is younger. But what I want to say is that doesn't mean when you turn 25 years old, you're done. You know what I mean?
You're right. You're
You agree?
absolutely right. So, so everyone, and part of it is helping people to realize their capacity for change and recovery. And oftentimes, this process involves learning new things, learning new skills, learning new things about yourself. And what I tell people is that there has to be an easier way, and no one would want to choose this sort of way. But very often through this recovery process, people come out with a greater understanding of themselves. And so that is something that can be valuable. And can be gained from this process.
Yes. So it's too soon to give up, for anybody who's.
Definitely. And again, there's always a chance for improvement.
Yes. Wow, this has been great. And I can tell that there is going to be a lot of people who feel hopeful about
I'm,
them getting their life back. They don't have to give
I'm
up.
glad.
Um,
Yes. It was
yeah.
great to talk to you.
Yes. Wonderful. Thank you. Dr. Zagar said something I want every parent watching to hear again. He said healing does not require a perfect fix. I totally agree with that. It is a process of learning what your nervous system is telling you and building the new neural pathways through consistent brain training. And sometimes people think that consistent means perfect. They're not the same thing. Whether your teen is dealing with FND, chronic pain, or another condition that does not have this clear structural cause, the same nervous system regulation principles apply for sure. I've seen it one too many times. Understanding the brain science behind these symptoms is often, if not the first step toward real recovery. Thank you so much, Dr. Zagar, for sharing his time and his story with our community today. And if this conversation helped you feel less alone, because you're not, this is exactly why I do this work. And if you're ready for a clear plan to help your teen move forward, download the free Teen FND Family Action Plan. The link is in the description box below. I will see you in the next video.